Hi, my name's Fadi, and today I'm going to talk to you about a project titled Impact that was conducted in Taradant, province in Southern Morocco. It was conducted in partnership with academics and NGOs or third sector organisations, a UK third sector organisation called Moroccan Children's Trust, and FAPE or Foundation Aman, based in Taradant. So a bit of background about Taradant. It's a provincial centre for the larger province, which is also called Taradant. In the last 10 to 15 years, there's been a large increase of migration from the villages on the outskirts to the city. A lot of the times, these people come to the city, and it's usually single mums. They come to give birth or to abandon their children. And if they stay and choose to keep their children, a lot of the times they find it very difficult, as no one teaches you to be a mum, let alone a single mum. So a lot of the times their children end up street connected, which makes them more susceptible and at higher risk of abuse and child labour and a raft of other forms of exploitation. This is one part of a wider issue within Morocco where sex out of marriage is illegal and there's a high rate of sex work. Voluntary termination of pregnancy is also illegal, and this leads to a stigma of children that are born outside of wedlock and their mothers. But there's also a lack of social services and a lack of alternative care structures and systems, which means a lot of these children ends up in institutions, and we found that almost 1 in every 30 children in Morocco has experience of being in institutions. So what we did when we had this information is we said, why don't we conduct a scoping review firstly and understand what is occurring, what are the gaps, if there's anything else we can do within Morocco and what we can learn. And then understand the different stakeholders' perspectives. So this could be mothers, fathers, people in care or care leavers and service providers. But we also had the objective of co-producing policies with stakeholders and to inform future research and hopefully, create community awareness campaigns. As you'll see, this all didn't go to plan, but that doesn't mean it wasn't good. So our methods to do this were a scoping review, and we aimed to look at studies in safeguarding alternative care in two comparable, what we thought were Arabic-speaking contexts in Tunisia and Jordan, and two comparable countries in the west of the UK and Australia. We also wanted to do focus groups and interviews with all those different stakeholders and do workshops to plan future strategies and develop policies. A particular method we did just with the children institutions where we used an issue tree. And this is where we got them to draw a big tree and write all the causes they thought of which led to institutionalization. And then at the top, the impact this has on them, on their families, and on the rest of society. So with our scoping review, we ended up reviewing 899 abstracts. And very early on, we learned to adopt a systems approach. And this looks at understanding the different components in a child protection system. And we also learned very quickly that Tunisia and Australia and UK and Jordan may not have been the best. It was better to focus our research on the countries of the Maghreb, which is an area in North Africa. We ended up doing 7 focus groups with 60 people and 6 interviews with key stakeholders. And our final workshops ended up being more research development workshops as we realized we were still too far from developing policies and community awareness campaigns. But our workshops became ways to co-produce and analyze our findings and also set future research priorities. So what did we find? So there's a fragmented system in the small town and in the province of Taradant, and this is due to a lack of collaboration between different actors and sectors, which leads to a lack of communication. So, a lot of people, a lot of different actors are working for themselves, and it's not that they're working good or bad, they're working in the way that they feel they know how to do child safeguarding. This is due to a lack of a legal framework that encapsulates child safeguarding or child protection and gives people authority and power. And this could be supported not just by legislation, but state funding, both on the ground in training and supporting social workers and developing larger policies. Another big thing was this notion of goodwill and professionalism. So because of this lack of state funding, there's lots of volunteerism, and there's international volunteerism. But what this develops is an informal system that's built on reciprocal relationships rather than what might be best for the child. There's also the lack of professionalism and a lack of management and accountability because of this reciprocal relationship and volunteerism, where it's very difficult to hold your funders accountable because it's not state funding. But there's also a lack of human resources. So, quite common in the countries in the minority world, there's a brain drain from the minority to the majority. So it's very hard to retain skilled workers and to train workers once to be skilled enough to work. A lot of our stakeholders mention this big need for public health campaigns, and this would shape the expectations placed on single mums and on young people, which would also then shape their aspirations for the future. And they also talked about the different reasons for abandonment and how there's a large amount of stigma for single mums who might lead them to abandon so they don't get positioned in that. The largest thing was this need for positive parenting practices. And this is to support both mothers and fathers develop the parenting skills that support them in not just providing food and shelter for their children, but also the love and care that all children need to thrive and grow. So our workshops changed from developing policies to where we presented all our codes and subcodes and those discussion points you just saw, and we presented them to the women who we had talked to in the focus groups separately, and then we presented them to the professionals. And what we did is we asked them to rank all our codes and subcodes and discussions from 1 to 20, and to add or take in any. And then we put them together. Once we got them to do them individually, we had a final workshop and we said, how can we put these together and develop future research strategies? And they came up with these 10 in these orders. And at the moment, part of the wider team, we are applying for projects to further develop men's and women's groups. But that's just one part of what our research added. So it's not just the development of publications and further research which we're doing, but our research also had a direct impact on the local NGOs we worked with. So the scoping review led to a methodology used by the local NGO to develop a regional-wide mapping, which consisted of 300 workshops with over 3,000 participants. It also led to the UK NGO we worked with to apply for a 50% increase of funding. We've been awarded a total of £20,000 to conduct future research, and we hope to further develop our understanding and knowledge in the region.